So as you think about that value chain and why it's really relevant these days, is in the medical device space, you see that value proposition is changing. It's actually pushing the boundaries of what it was previously.
Hello, welcome to another edition of BioBreak. I'm Nick.
And I'm Joris.
Hey, Joris. I often hear today in the news quite a bit about value proposition, and I wonder if we could spend a few moments just talking about that and what your take of value proposition is in medical device development.
That's true, Nick. We often hear that term in our phone calls and in our conversations with clients. And value proposition is an incredibly important term because you need to get it right early in the process.
Absolutely.
Early in the design process. So what does it mean? Value proposition is really the value that you deliver to your customer, to your, that could, in our case, it's often a patient or a clinician.
Right.
And so in the case of a diagnostic instrument, that's often delivering a diagnosis that then can be tied back to a treatment. And the other terminology that's I think relevant here is the value chain. So the value proposition is the value that you deliver, and the value chain is the value that a customer needs all the way from the beginning of their journey till the end. So take a patient that presents with a set of symptoms, feels unwell, and they present at a doctor's office.
Right.
The value that they really need and care about is that they are seen, that they're diagnosed appropriately, and that they are also receiving the right treatment. So there's a diagnostic component, that's a value proposition there, and there's also the treatment portion. So as you think about that value chain and why it's really relevant these days, is in the medical device space, you see that value proposition is changing. It's actually pushing the boundaries of what it was previously.
Now, what do you mean by that? Like, how could it be changing?
Well, it's changing by having smarter and more intelligent devices. So the devices on their own, they push the boundaries of where they were previously. So it's not a diagnostic device, it's not only a diagnostic device, it now starts to really have predictions associated with it, algorithms and smart AI algorithms, for example, that can predict the right treatment instead of having a physician that would traditionally do this. A good example as well would be traditionally surgeries were done with the scalpel, and still predominantly are done with the scalpel.
Yeah, got that value proposition. How sharp can we make this thing? Goes in the hands of the surgeon because it cut.
Exactly, and the value is really in the cutting of the procedure, and the surgeon really, the precision and the skill of the surgeon add the remaining part of that value to the scalpel. So there's a huge part of that. Whereas nowadays you see robots for non-invasive surgery that take on a lot of that kind of precision and cutting, and also knowing where to cut, knowing if you cut the right piece of tissue away. All of that's done by the device. So the device is really pushing and taking over more of that value for the patient.
Very cool. That's a sharp example. I like that, cutting right to the chase.
Cutting right to the chase with a sharp example.
There you go. Very nice. Well, it's another BioBreak. Have a great day.